My name's Kate Johnston. I currently work at Wirral Park Hospital as a Trainee Nursing Associate on Ward 22, which is a ward for medicine of the elderly. I joined the NHS in August 2015 as a clinical support worker on Ward 10 at Wirral Park Hospital, which is an orthopaedic ward. Since August 2015, I also work as NHSP, which is a bank work as well, so I work on a variety of wards as well. I decided to join the NHS because I've been working in the private sector for many years, nursing homes and other variety of things, and then I just thought it was my time to join the NHS and show what I can do and give my skills and abilities and improve on what I already know. I decided to apply for the Trainee Nursing Associate role when I seen it up in the staff room on it was a poster to go and introduce ourselves to our PEF, just to tell us what was it about and what it entails and the qualifications you needed. And I applied on the last day and then I was successful in getting to the first interview. I enjoy the hands-on approach of the patients, with not just the patients, the relatives and all the other multidisciplinary teams. I enjoy making patients feel safe and making their journey as comfortable as possible throughout the stay with us. Person-centred approach to me is very important because it's not just about treating their illness, it's treating their mental health and the well-being, and our role over the 2 years will be seeing it from all other aspects instead of just treating their illness. We treat everything else, so person-centred approach is very important. In 2 years' time I see myself as a qualified nursing associate on the ward, whatever placement or whatever ward I'll be on, given my knowledge and skills that I've obtained over the 2 years.
I'm Linda Hamilton and I work for Wirral Community Trust. I've worked in the NHS for nearly 18 years. I started as a relief of carers service, looking after their elderly relative and giving them a bit of respite so they can go out for a few hours. I got redeployed 9 years ago to the continent service. I've worked there until I got my current position, and I've also worked for Marie Curie night sitter for 6 years with CWP, which I enjoyed very much. What I enjoy working most within the NHS is delivering care to people and helping with the needs. They're all individuals, they all have their own needs, and I can help them as much as I can. I've met a few colleagues during my service who have inspired me. One in the continent service where I worked, she really pushed you to fulfil all your abilities, made you go further, and inspired me to go for the role. All my placements are very varied, which is a good thing. I have got my 2-year placements. I'm in learning disabilities, neonatals. I'm going to do a spoke there. I'm going to neuro stroke unit. I've never done anything along the same lines before, so it's going to be interesting, and it's going to be new skills that I'll be learning along the way. In the next few years I can, obviously I'll be a qualified nursing associate. Hopefully I can go back maybe to where I came from, helping out with my old job role, but in a higher banding, and supporting the nurses because it's a very busy service.
Hi, my name's Thomas Owens and I currently work for Cheshire and Wirral Partnership. Prior to joining the NHS, I worked for a children's home, and even though I loved the job working with the kids and working within the children's home, there wasn't the developmental opportunities for the organisation I was with. So with me missus working as a dietitian with the NHS, I thought she bigged up the role and bigged up how great the NHS was to work for and how many opportunities there would be for me. So yeah, I applied for the NHS, and obviously 12 months down the line I'm currently on a role for the Nursing Associates. Both the academic and the work experience side do both appeal to me. I've previously been to university before, but I like the aspect that predominantly it's work-based and I'm learning on the wards and in community, and the sort of the university side supplementing what I'm learning on the ward. Patient-centred care is really important to me, and it's been pretty predominant on this first placement I'm on, which is a dementia ward. I feel the staff there do it really well in terms of focus on patient-centred care. They understand the mental health needs of the patients, but also they take time to ensure their physical needs are met as well, so it's been quite a rewarding first placement to see in firsthand, I don't know, the full package in terms of physical and mental health being care provided to the patients. So me and my missus had our first child 6 months ago, and to be honest, he sort of provided the inspiration for me to apply for this role, just because it gave me that progression, and I sort of wanted him as he grows up to be proud of the position and the role I'm in, and working for an organisation for the NHS. It's sort of, I don't know, I feel quite proud of the work I'm doing, and I hope he feels proud of me. So as my inspiration, he's probably my inspiration really, to do as best as I can for him. So.
Hi, my name's Alison Reid and I'm one of the Trainee Nursing Associates with Cheshire and Wirral Partnership Trust. My NHS journey up to this present point has been that I worked for a couple of years for Calderdale and Huddersfield NHS Trust as a band 4, as an assistant practitioner within the therapies team, and then I applied for a job with Cheshire and Wirral Partnership Trust as in the Recovery College as the physical health trainer there. And after seeing the advert for the Trainee Nurse Associate, I thought that that would be a really good way to pilot a scheme and a new role that was coming into the NHS. The reason that I decided to apply for the Trainee Nurse Associate role was that the General Manager in the East really encouraged me to do so, and felt that I had the right contributes that we needed for a pilot scheme. On a personal note, for me, it's really important to see that people that have worked as healthcare assistants or support workers for a long time get the chance to really enhance their knowledge and the skill sets that they've got, and given the opportunity to progress up the ladder. The importance of the different placements for me in this role is that you get to observe different styles of work, different styles of leadership, and also to be able to develop your skills in a very natural way, and looking at a person as a whole being rather than just focusing on one thing about that person. It's often the bigger picture that makes a change in people's lives, and it may well be just a small thing that can then lead them to that journey of recovery. Hopefully at the end of this, in 2 years' time, I will be a qualified nursing associate, and I'd like to develop that role, hopefully within one of the community teams in mental health. And then I'd like to eventually part-time go on and do my degree and be a fully qualified nurse. But I think for me, it's about getting the message through to all the clinical support workers out there that if I can do this, you can too.